gynecologist when, when the mother does not find any secondary sex characters. That is late, I will call it. In case if she has to gain in a height, what should be the tips which you can offer to the gynecologist? Please, sir.
So what we can do is, as far as keeping awareness to the parents about that, if you find a girl is short, she's not going, and they come to you, so you tell. Most what happens, most of people tell them कि अभी time है, कोई बात नहीं, बाद में देखते रहेंगे. But if any girl who's short comes to you, you must always suspect turners, because you will not get all the typical features of turners in these girls. So that's why if girl is there, please get a karyotype done. And karyotype is not costly these days. It's in 2000 rupees you can get a karyotype done. And if you get a karyotype done, bang, you hit the diagnosis. So if you hit the diagnosis, you can just send the patient to the right person and get the treatment at the proper time. Now this may happen many times missed. So therefore, they may come at 10 years. Now it's becoming, the cycles have started coming earlier. So many girls who are having periods at the age of 10 and a half, 11 years, so they come to maybe to gynecologist 10 years, 11 years, and other girls in the class are annoyed. So if you find that girl is short and there's pubertal signs, get a karyotype done. Get a karyotype done immediately, you hit the spotted diamond. Because the earlier you start the growth hormone in these girls, the better the results. Or if you find a girl who has some dysmorphic features like webbing of the neck, she has a short fourth metacarpal, has, cubitus valgus, she may be having wide angle of the arm, or she may be having wide chest, then because many times, these type of features are there, you must immediately pick up and try to get a karyotype done. Because if you pick up a girl with just doing one karyotype, you have helped this family a lot by picking up the proper time and then finally getting a good treatment at the proper time and lining up and giving estrogen at the proper time. So the results are very good. So I think, the take home is, I say, any girl who is fine short, get a karyotype done and see what's happening in that girl.
I think your suggestion is very much valid. Sir, another question which has come, that this growth hormone therapy injection is to be given on a daily basis. It has to go on for almost 5 years, and it has to be started just before the puberty time to have the maximum height and things like that. Now, how will you convince the gynecologist that this particular dosage is important? Because you already said if she misses good compliances, that she hardly misses the injection therapy. 80% of the injection she must take. So how are you going to convince the gynecologist and the parents about it?
So it's very simple. What we do is that normally there are two ways. One is that you have to explain, to sit with them and explain to them if they miss a dose, they're not going to reach their final height. And a girl with Turner syndrome already is under the girl with Turner is already in a position where they already have a psychosocial impact about getting problems in later life regarding pregnancy and features. So if we sit with them, tell her if that she gets a good height now, and if she get at least she'll have some personality and some features which will help her in her psychosocial and general overall look, and general well-being will also be better because it contains good impact. The self-esteem will be better. So when you talk about these things to the parents and tell them that this part, the other part can be also looked after by the gynecologist, and this is now the main factor comes with cost, because they have to take for 4 or 5 years daily injection 4 or 5 years. But when you talk to them and explain to them and convince them, they are this thing. The ESI, the CGHS, there many places now they have started reimbursement for girls with Turner syndrome to take this growth hormone. So it's where then become. And second thing is the convenience. The growth hormone now injection are very easy. There hardly any pain coming to the patient. The only thing is they have to be taken daily. Though there in the future, I think weekly injections are coming, but it may still take time.
I think I am going to wind up this particular thing as far as the Turner syndrome is concerned, with a request to all gynecologists that they have to take a lead role. The height and the full growth potential will be done by the pediatric endocrinologist, but thereafter you have a lot of role to play, whether it's an ART, and as Dr. Kocher has said, 90% of people will have ovarian this premature ovarian failure, and that also you have to handle it very carefully. Now, coming on to a few questions which I've got so far on polycystic ovarian disease. Sir, can skinny patients have PCOS?
No, I didn't get. What's the question?
The patient who is very thin, can she have PCOS?
Okay, okay. So, in the past, it was a common belief that PCOS occurs only in obese girls. Fat girls, obese girls, they will have PCOS. And they will have all these menstrual problems there. No, they have found, the studies have been done where they found 1 in 5 obese population is thin. That's called as thin PCOS. So these girls, even having thin, they can have PCOS, they can have ovulatory cycle, they can have hypoandrogenism. So it is not that it is basically a disease of the obese. So if there's something called as thin PCOS, so you can have even a thin girl can have PCOS.
Sir, another question, which is observation for we gynecologists also, that PCOS can start at any age. And can PCOS go away with age? See, these are the two questions I've asked you. So I think, it is my mind that this is a metabolic disease. It can definitely be reversed. But in case if you lose your full control on your lifestyle, the PCOS can start at any age. And the similar way, the PCOS can go away with any age. What are your comments on this, sir?
So as far as PCOS starting at, yes, it can start at, if it starts at puberty, they can start period problem. If it starts at adolescence, they have all this hirsutism and acne and period problem. It can go on later and then fertility problems in reproductive age. So all this can occur at any age, and it can go into menopause, because this is basically, it's not a disease of the ovaries which people have a myth on. It is basically an endocrine issue where there is imbalance between the hormone of LH from the range from the pituitary and estrogen, which is released from there, and insulin resistance. So there's a whole mechanism which is working together. So all these things are causing this in the patient with PCOS. So therefore, it can occur at any age. If the age of insulin sensitization, insulin resistance is there, and along with the LH levels are high, you can get PCOS even at the age of 10 years. So therefore, it's at any age it can occur. Now, second question is that if you leave PCOS, so therefore even after menopause, if you have not treated the androgen level and you have not brought down insulin this thing, you will still have a PCOS even in menopause. So therefore, there is no age. Now, if we do not treat the PCOS, what can happen is that if I leave the PCOS, then what happens is time comes, these ladies are more prone to have endometrial issues like endometrial carcinoma. So why? Because PCOS is condition where you have ovulation occurring, ovulation occurring. In PCOS, this does not occur. You have anovulation. So you have missing ovulation not
Yes,
occurring in one
endometrial
cycle.
hyperplasia is there.
Yeah, endometrial hyperplasia is there, and therefore ultimately uterine cancer, uterine carcinoma, which will not occur if you have progesterone and estrogen, which is normally occurring. So therefore, they are more prone to have endometrial hyperplasia and endometrial carcinomas. These ladies with PCOS. So but PCOS can persist till menopause. So that's why there is no this thing. You have to maintain the lifestyle and you have to keep the hormones under control, even during the menopause. So you may find many ladies they have hair at the age of 60 years or 65. They say नहीं ये तो normal है because menopause में हो जाता है. But that's not the reason. The reason is because of the androgen and with insulin resistance which is there, that is causing this.
Sir, I'm coming to the last question before I wrap up. Now we have find that in adolescents, sometimes these patients present with primary amenorrhea. How long can you go without periods in PCOS? You need to guide the gynecologist here.
Oh yeah, that's a very important question, because the gynecologists have got a wrong feeling about this periods problem in girls with PCOS. You see, adolescent PCOS when it starts, they can come to you. As I told you, first 2 years is very important. First, after 2 years, cycle less than 20 days, cycle more than 45, this PCOS you will die. But this length of the cycle can be like, they can be bleeding every 20 days, every 15 days, they keep on having. They can have periods for even 10, 15 days, 20 days, 30 days, 50 days, 35 days together. There may be girls with PCOS who may have no periods at all. There may be girls with periods who will not have periods for many years, even 2 years, 3 years also. So all these manifestations can be there as far as periods are concerned. It is not that if you miss a cycle of this thing, but these are all the presentations of girls with PCOS. They may have periods persisting for 10 days, 20 days, 20 days, 30 days. There's many girls they come with अभी तक periods चली आ रहे 20 दिन हो गए 22 दिन हो गए. So you can have that. You can have a girl who started with periods and for 1 year period there's no periods coming out. You can have a girl who never had periods at all, amenorrhea at all like this. So just PCOS. So PCOS can present with multiple forms in as far as ovulation is concerned and as far as periods are concerned.
I think, Dr. Kocher, it had been absolutely wonderful.
I think
Both the topics
there are
has.
a few questions in the chat box. Dr. Jain?
I can't see anything, sir, because my
Yeah.
video, when I see all the list, everybody's video is muted. But as far as my
Okay.
name comes, there is no video there. So there is no sign of the video, so I can't see anything.
Okay. Should
So
I
I'm going
ask
to wrap
that
up.
questions, ma'am? Or
Yes, you can ask. Yes, you can ask.
because it's more interesting where from the talk and very relevant probably where probably I can take them through the few questions which was asked with your permission, ma'am. So there is one
Yes,
question
sir.
on question of how often PCOS is associated with a family history of diabetes mellitus.
Oh,
That is
okay.
one question.
Yeah. So, in the past, we never knew about the genetics of PCOS. Now it's a very common, they say PCOS is it's a genetic, and PCOS is
Just 1 second, sir. Mute the person. Yes, sir. Please continue.
So, PCOS is a genetic. So PCOS is the genes of diabetes are the same as PCOS. So therefore, it can run in families. The PCOS, like diabetes runs in families, this PCOS can also run in families. The mother can have, the grandmother had it, the daughter can have it. So this is known to occur like this. So they are now comparing that PCOS is like a diabetic, the genes is like a diabetic, and therefore you can have conditions where the girls will have it and the mother will have it, therefore it can run in the family. So therefore it is known. It's like a genetic condition now.
Okay.
No, no. So the question has been whether these patients of PCOS have a family history of diabetes. Is the
Oh,
diabetes and PCOS related?
no, that is related, but we do not take it as a diagnostic criteria in inclusion in PCOS. You may have, that the diabetes, acanthasis nigrans, these are not, a part of the diagnostic feature. Yes, hyperlipidemia, hypertension, diabetes is a metabolic part of metabolic syndrome in PCOS. So you can have diabetes with PCOS.
So there is another question on Turner syndrome. What is the earliest age to start growth hormone?
Okay, very good question. See, in the past, we used to be, like we were not sure about when to start 6 years, but now it has been shown that if you start the earliest, so what they have taken is 4 years. If you find a girl is falling against the growth chart in a Turner's growth chart, at the age of 4 years, you can start growth hormone. And you will get very good results in these girls. And many of these girls, there's a Dutch study, there's another study where they have found they almost reached the predicted adult height in these girls who were started at earlier 4 years and 5 years of age. So you can start by as early as 4 years of age. There's one study where they started at the age of 1.5 years. But it is not a very, it's a small group of turners only. But as most of the time, it should be 4 years of age, you can start growth hormone.
Okay. So there is a
Okay.
question by Dr.
Last
Sunita.
question.
Yes, ma'am. There's a last question from Dr. Sunita of if acne and hysterism is not responding to hormonal contraceptives in adolescence, then what should be the treatment?
So if you try to see first of all, see the lifestyle. You see the weight. If the baby, the patient has got weight is more, try to do the lifestyle. If still not working, then what we do is we start using, a compound like isotretinoin. Isotretinoin is very helpful. Retinoid is really helpful, especially oral to patients, and it helps a lot in the acne part. Hirsutism, it will not help, but an acne part, it really helps a lot. And in the hirsutism part, you might have to go for artificial techniques, like you might have to go for epilation, you might have to go for electrolysis. These are various methods to remove the hair. So that can be done if they do not respond. Many times it takes years to respond. You start a girl, I remember one girl we started at the age of 16 years. She responded at the age of 20 years, her face became clear, her sister became clear. But you have to be patient. The problem is the patients are not patient. They want jadoo treatment. So within 5-6 months, they say, "Fada nahi hua, we did not get result, we don't." But ultimately, most of them will respond. That's why I told you, 5 years you should let, it's called as gynecology mature. 5 years after menarche. So many of these girls should have to wait for at least 4-5 year treatment, then results will come.
Dr. Kocher, I think it has been absolutely wonderful. My sincere, heartfelt thanks to all the guests who had joined this particular meeting. And I think after a long time, I found that this particular clinical meeting had been very fruitful. And we take credit that it was well conducted. Thank you very much, everybody. Thank you very much, Dr. Kocher.
So on
Thank
behalf of No Notice as well, we would like to thank firstly Dr. Jain for wonderfully moderating and taking us through in a very interactive format this for insightful session, and also Dr. Kocher for giving us a lot of insights. I'm sure the attendees have did gain a lot of thoughts into how to approach practically from a point of Turner syndrome and PCOS. So I do thank both of you, ma'am and sir, and also thank the respected attendees for joining.
Dr. Kocher, talks of Dr. Kocher is always mesmerizing. Sir, you have to give me the recorded version of this particular thing,
Sure.
of this particular meeting of DJF. Thank you very much, everyone.
Recorded. So
and
thank you.
Thank you, Dr. Sharda, and thank you everyone for listening. I hope something went through. People got some message and some information.
Absolutely, sir. Wonderful, wonderful, wonderful.
Thank you, and thanks for Notice for conducting this meeting. Okay then. Thank you, everyone.
Thank you all. This brings to the conclusion of the meeting, and have a great day ahead. Thank you.
Thank you.
Thank you so much. It was